As a med student, I have worked alongside both general practitioners and specialists, and the one thing that stood out to me is that general practitioners often don't get the credits they deserve. But I'm gonna put that right. Oh yeah, and stay tuned because I am sure that I will convince you to always see your general practitioner first. The population of patients. A general practitioner in general sees everyone, and that can be patients with just a common cold to serious conditions like heart arrhythmias. But that is their strong suit. They are specialists in deciding when a problem is severe or not, whilst the specialist sees more rare cases because they are specialized in that field. For instance, if a general practitioner would see 100 patients, only 1 or 2 of them will have heart arrhythmias. If you would do the same analysis in a cardiology setting, you would get way different results. If you would take 100 patients from a cardiology doctor, 40 to 60% of these people will probably have arrhythmias. A specialist knows everything, well, almost everything, about his specialty, whilst a general practitioner knows a lot about a lot. Everyone thinks based on their knowledge and what they see most often. That is why you are more likely to get unneeded treatments and diagnostic tests done by a specialist than with a general practitioner, because a general practitioner sees the population that is more close to the real world, whilst the specialist sees filtered people that have a specific condition concerning the specialty that the specialist has. Okay, let me give you an example. If you would go to the ER with the symptoms like abdominal pain, chances are that you will get an X-ray, echo, or even a CT scan, or any other scans, if you will. But your general practitioner would do none of that. The reason for this is that ER doctors often see the severe cases of abdominal pain. Things like obstructive bowels, appendicitis, or even cholecystitis. Don't worry if you don't know these diseases, but the thing is that most of these diseases I just mentioned can be life-threatening, and thus they require immediate treatment. But in most cases, your tummy aches just come from something you ate wrong, or you have a viral infection, or maybe just some stress. And this is something that your general practitioner can handle best. That will not only save you time, but also unneeded treatments that could potentially harm you, and that will cost you way less money. Talking about money, we'll talk about that later in this video, so stay tuned for that. Knowing your patient. Okay, let's take the same example as before. In the ER, doctors only know the things about that you told them, or what is mentioned in the medical records. That is because these doctors actually don't have the time to dive deep in your medical history. But your general practitioner does. He knows your background, your concerns, and your family history. And because you have this relationship with your general practitioner, that allows for a more personalized care, because he knows what your concerns are and what is most likely going on based on your history. More aggressive approach. Imagine you having severe back pain and you go directly to an orthopedic surgeon. That is a doctor that specializes in bones and muscles. This person will probably order X-rays, CT scans, and MRIs, or any other diagnostic tool. And then when you get the results, it just says that nothing is visible on these scans. You go back to the orthopedic surgeon to actually discuss what is going on here. But in the time that you actually get to see your orthopedic surgeon again, the pain is actually gone. But why? Well, you don't know, but your general practitioner knows. In 90% of cases, your severe back pain will resolve within 6 weeks. At that stage, only supportive therapy is needed. Things like painkillers. Only if the pain lasts longer than 6 weeks is the point that you should take further action. Early detection of problems. Up until now, we've only talked about diseases or illnesses that you have right now. But a big part of general practitioners' work is actually prevention. Because he or she knows who you are and knows your history, your general practitioner will be able to decide which illness or which disease you are more likely to get. And thus, you can both start working on prevention. In most cases, you will only consult a specialist if you already have a problem. Well, some diseases are actually very preventable, and these diseases you actually don't want to have. I'm talking about diabetes, lung cancer, obesity, and many others. And preventing a disease is way less costly than treating a disease. So you might want to consider that. Accessibility. Often it is much easier and faster to get an appointment with your general practitioner. It can take months for you to actually see a specialist. By that point, your problem that you had could already be very much worse than it was, and that could lead you needing a harsh treatment, which can be very uncomfortable. But again, this could have been avoided if you just went to your general practitioner. Oh yeah, by the way, if you are enjoying this video, please like and subscribe because that really helps me out. Affordability. Okay, we've already briefly touched on money, but in general, your general practitioner will not only save you money by the amount that he asks, but also by avoiding unnecessary tests and treatments. Overall, this will keep your healthcare cost down. In Belgium, we try to stimulate people to first see their general practitioner before seeing their specialist by the amount that your insurance actually pays back. That means that your reimbursement will be much higher if you get referred by your general practitioner to a specialist than if you would go to your specialist directly. Holistic care. When I say holistic care, I don't mean looking at your whole body. I'm also talking about mental health. If you get a harsh diagnosis, is there some room for you to express your feeling or what you're thinking about? Most often your general practitioner doesn't have time for this because the next patient is already waiting. He just wants to fix you up as fast as possible. Whilst with your general practitioner, he has eye for it all. That's if it's a good one at least. The most important thing here is that you feel a bond with your general practitioner, that you can tell him everything you need, and that your general practitioner genuinely cares. A side note that I want to make here is that even your general practitioner might have a lot of patients to see next, and that is not always possible. And in my opinion, that is actually one of the biggest downsides of Western medicine, because 50% of how you feel is actually controlled by your own mind and your own thoughts. If you found this video helpful, then you will also like the video where I compare being a Belgian doctor with being a doctor in the US. See you there.